Hi, I'm Danielle Matias at Caring Medical Florida, talking today on sciatica, pelvic tilt, SI joint instability, and leg length discrepancy all in one and how they are related. Specifically, I'm actually presenting Dr. Hauser's case in this video. This is actually an x-ray from Dr. Hauser, and I show this because this is what like leg length discrepancy or instability might actually look on an x-ray. These are your SI joints right here, and then these are specific measurements. You can see kind of from the bottom, to the top of the pelvis, and as they compare to the other side. So you can see these numbers from side to side, there's a several millimeter discrepancy there based on these measurements. There are two different types of leg length discrepancies. So we call them structural or functional. Structural leg length discrepancy is where you actually have one leg that's longer than the other. Like if you measured each leg individually, you would see that there is a discrepancy there. A functional one is very, very common actually that we all might have to some degree, where just depending on how your pelvis is rotated or the position of your pelvis as related to your SI joints in your hip, could cause one leg to appear shorter or longer than the other, even though the legs are actually the same length. So again, just depending on your pelvic position or your pelvic rotation could make it look like you do have a leg length discrepancy, even though the legs are the same length and it is actually more related to your pelvis. I show this slide about sciatica because a lot of these go hand in hand, and again with Dr. Hauser's case, with his SI instability and pelvic tilt, it was causing sciatic-like symptoms. So this is the sciatic nerve here that goes down, straight down the back of your leg. It's made up of several nerves that all combine together to make that one big nerve, and that nerve travels underneath your piriformis muscle as it goes down your leg. We've done videos on sciatica as related to the piriformis syndrome as well. You also could have disc herniations, disc bulging, degenerative disc disease. All of these can play a part in the development of sciatica as it affects your nerve roots. And if we look specifically at this picture here, if you have, this is your SI joint right here, if you have an SI joint instability that's maybe contributing to a leg length discrepancy, but even just that instability can also increase the pressure on that nerve or any of these nerve branches that feed into the sciatic nerve. The same goes for even degenerative disc disease. We know from research that degenerative disc disease doesn't just happen overnight. It starts with a ligament injury or an instability component that over time wears down your discs and then actually puts more pressure on your nerves. Now, just to go back to Dr. Hauser's case specifically, he did have a sacroiliac or SI joint instability. Here, these are the SI joints right here, one on each side, and this illustrates what's called the sacrotuberous ligaments, which are actually big powerhouse stabilizing ligaments of your SI joint and your pelvis in general. When these get injured from overuse, trauma, repetitive bending and twisting for years and years and years, if these ligaments get stretched out, then they simply just cannot hold the joint stable like they should. They're loose, they're floppy. I call them stretched out rubber bands a lot in the office. So instead of holding your bones and your pelvis stable, they're allowing for extra movement. If your pelvis is moving more from this instability, it's very easy to understand how it could rotate more than it should or kind of hike up, contributing to leg length discrepancy. Now you also have muscles, of course, that help with pelvic rotation. So if your muscles are very weak, absolutely your pelvis could rotate, and then you need to work on a muscle strengthening program for that. But in patients that they have strong muscles or they've done the physical therapy, they've worked on building their core and their pelvic muscles, and it's just not working, they're still getting SI joint rotation or whatnot, that's where we really do need to evaluate those ligaments. The last thing I do want to talk about is people that have this pelvic rotation that again is not fixed with more conservative therapies. They have that SI joint looseness or laxity that's causing all that rotation. Our bodies are kinetic chains. From the top of your right hip down to your right foot is all a kinetic chain. Increased motion, excess instability in one area can easily gets transferred to another area. Like if your SI joint is loose, it's going to put more pressure on your hip, which will travel to your knee, travel to your ankle, and so forth. We all know the song, your hip bone's connected to your knee bone, and so forth. It's so true in the human body. So if you have excess motion here at that SI joint, more motion or more force, I should say, at your hip, your knee, and all the way down to your ankle. So these things may start out actually as a low back issue, and then over time spread, down to the foot, or even vice versa. It could also travel up.